to Dr. Lateef, who's going to talk about autoimmune sensorineural hearing loss triggered by neurocysticercosis. And I will hand over to you, Hamza.
Hello, good afternoon. My name is Arman Lateef, and I'll be presenting a clinical case report of a patient who presented with two seemingly different diagnoses, but may have an immunologic relationship. And so this case is about an autoimmune sensorineural hearing loss and neurocysticercosis. My only disclosure is that I am a high school student, but I will do my best to represent the senior clinicians, Dr. Davies and Dr. Arabshi. And so the patient in this case was a 37-year-old Hispanic male immigrant from Honduras who presented first to the ED with acute exacerbation of vertigo, nausea, and headache. He had a normal neurologic examination and basic labs. He was thought to have a migraine. However, a CT showed a R hemispheric calcification. And so PT was discharged with follow recommended with ENT and primary care physician. And so when he was evaluated by the ENT, he was also found to have hearing loss and tinnitus as symptoms as well. And so he was diagnosed presumptively with steroids for Meniere's disease. So over the course of the next few months, he developed unremitting dizziness. And so a more detailed history revealed that he had a prior history of tapeworm infection as a teenager before he had immigrated to the US. And so the specific details of that infection and treatment were not known. So at this point, several diagnostic studies were ordered as part of the workup. His laboratory workup was positive for anti-HSP antibody, and he had an abnormal electrocardiography, left greater than right. And so his VNG was positive for both central and peripheral findings, and bithermal caloric irrigation suggested that abnormal peripheral function with a 57% weakness in the left ear. And so additional imaging was ordered, and an MRI of the brain revealed post-inflammatory calcifications in the right parietal lobe, as well as generalized volume loss, greater than would be expected for the patient's age. And so the patient was also referred to rheumatology and neurology. And so he was diagnosed as having neurocysticercosis, as well as migraines by neurology, and treated with nortriptyline for the migraines. And so beta histine was added to his treatment regime for the Meniere's disease, and his symptoms did improve with combined management of migraines and Meniere's disease. Okay, so why is this case of interest to us? The patient seemed to have two unrelated disease processes, but upon closer review of the literature, we thought perhaps that they may be related after all. So Meniere's disease occurs when an abnormal amount of fluid causes increased pressure in the inner ear or labyrinth. And so people with Meniere's can experience symptoms including vertigo, tinnitus, hearing loss, and a feeling of a fullness in the ear. And so various triggers for MD have been recognized and range from smoking and alcohol consumption to recent viral illnesses, allergies, and anxiety. And so neurocysticercosis is typically seen in developing countries and is caused by the larval form of parasite Tinea solium, infecting the central nervous system. And so it commonly presents with seizures, and such a manifestation of dizziness associated with Meniere's disease has not been previously reported. And so the treating physicians thought that perhaps there is an immune mechanism that may explain these two diagnoses presenting in the same patient, and perhaps the immunologic response to the NCS had triggered the autoimmune sensorineural hearing loss in the case. And so this may be explained by the antibodies to the heat shock proteins. And so there's conflicting data on how reliable these antibodies are in the PTS with Meniere's disease. And so, however, they do play a role. They may play a role in the autoimmune processes in general. And so it is well known that there is an amino acid sequence homology between HSPS of different species. The presence of antibodies against HSPS may, on the other hand, be helpful to protect the host from recurring infection. And so, on the other hand, presence of such antibodies may contribute to autoimmunity through cross-reactivity between HSPS and tissue-specific proteins containing similar epitopes. And so 84% of the patients with active neurocysticercosis and 71% with inactive neurocysticercosis were seropositive for the HSP. And additionally, 77% of pigs infected with T. solium were seropositive. So it could be that, the HSPS and or their antibodies were involved in the development of autoimmune sensorineural hearing loss in our case. And so to conclude, to our knowledge, this is the first reported case in the literature of Meniere's disease